is your stem.
Yes, ma'am.
Both are ready?
Yes.
Okay, so if you've read and understood, considering it history taking communication skills station, please begin.
Hello, I'm Dr. Ishita, one of the surgical doctors here. Working for Mr. Man, our in-house consultant. Can I confirm I'm talking to Mr. X, the on-call consultant?
Yes, it's me.
Okay. I have called you to inform you about one of our patients who underwent mastectomy along with axillary clearance 2 days back.
Okay. Okay, could you summarize your case?
Yeah, I'm summarizing. She's an elderly lady with the background of COPD along with mild left ventricular failure. She actually underwent mastectomy with axillary clearance 2 days back. She was about to get discharged tomorrow or the next day, but unfortunately she has developed swelling in her axilla along with shortness of breath today. But the problem is her daughter wants to take her home. And I actually tried my best to convince her that it's not for her, it will be a bad decision to take her back home today. But actually, they didn't get convinced and they insisted on getting discharged today.
You told me the wound, you are putting a suction drain on it?
Yeah, she has a suction drain. Her collection is most likely for more than 400 ml till now. And its color is also blood mixed.
Mm. You told me her daughter convinced her. So did the patient make her own decision, or she was bullied in making this decision to go home?
I think it's her daughter who actually convinced her mother that it will be best for her to go back home. I'm sure if her daughter could not try to convince her, she would certainly prefer to go back home after she gets well.
What I want to know is this patient is alert and capable of making her own decision?
Yes, yes. She is well alert and she's capable of giving her an informed decision.
Mm. What do you think had happened to this patient?
I think this patient, as this patient has shortness of breath, and she also has COPD on her background. She may have exaggerated COPD, or she may have she may have left ventricular failure as well, or another possibility is it may be pulmonary embolism.
And for the wound, what do you think is the cause of the swelling?
what about the axillary swelling?
Yes.
Yes, what do you think it's cause?
I think it may be as the brain color is fluid coming from brain is blood mixed. It may be a reactionary hemorrhage or bleeding from a slip tube, or another possibility is it may be lymphedema or axillary vein thrombosis, as she has the shortness of breath as well.
What do you think is the cause of bleeding?
Bleeding may be from a slip from an actively bleeding vessel, or
does she receive any medications that might cause bleeding?
No, actually, I don't have this kind of information.
Okay, so what do you think is the cause of shortness of breath?
Shortness of breath, this might be due to COPD, as she has COPD on her background. It may, after in the postoperative period, she may have exacerbated COPD, or it may be a left ventricular failure, as she has COPD on her background. It may be left ventricular failure as well.
So what is your plan for those events, for those complications?
As I'm suspecting hemorrhage, I will repeat full blood count to check the hemoglobin to see if there is any continued bleeding, and if there's wound hematoma, I will have to remove it. If as I'm suspecting pulmonary embolism along with axillary venous thrombosis, I will have to rule out by doing a CT angiogram.
Is this patient stable?
Yes, now this patient is stable, but she has shortness of breath, just struggling.
So, is it safe for her to go home, in your opinion?
No, obviously no. I'm not thinking that it will be safe for her.
Why? Why it is not safe?
It's not safe. One point is she has shortness of breath, and pulmonary embolism is a possibility, and another possibility is reactionary hemorrhage, as she has axillary swelling.
So what will you do if she insisted to go home?
I will try my best. I have tried my best actually to convince them. I will inform both of them, the patient and her daughter, about the possible complications if she gets premature discharge today, especially because her home is 60 miles away from the hospital, and she will not be able to come as soon as she gets any trouble. And I will also inform the patient that she will, as we are not being able to discharge her medically, she will have to sign a document where it will be stated that she wants to get discharged against medical advice, and she will be fully responsible for any kind of complication that I have mentioned.
Will you warn her about anything?
Sorry, I couldn't.
Will you warn her about any signs or symptom or something like so?
Yeah, I will also inform her about some warning signs and symptoms, like if she becomes more unwell, or she has increased collection in her brain, then she will have to seek advice, or she will have to come as soon as possible to the nearby hospital, or to come back here.
So what about the drain? What she will do?
I will leave it in place, obviously, as she has drain collection more than 400 ml. But I will teach her how to take care of it, and I will advise her to visit a nearest clinic to remove it when the fluid becomes less. and I can also involve the community nurse to take care of it.
Okay.
All right.
Okay,
So,
thank you, Mr. X, for hearing.
good. Thank you.